Thank you. Thanks for the great presentation. Hi, everyone. My name is SongHae Jeon. I'm part of the modeling support team within the contact tracing innovation section for CDC's COVID-19 response. Next. So now we'll switch gear and we'll talk about our modeling work, our team's modeling work that estimated the cases prevented by contact tracing in a national level and some of the findings and challenges with this effort. Next. So here's the high-level overview of our model. First, we collect the data from the field. So this data include the reported case counts, as well as the contact tracing performance metrics, such as the percent of cases and contacts notified, and the timing or the speed of notification. In the second step, based on this collected data and mathematical modeling, we generate a hypothetical curve of what would have happened without contact tracing. And in the final step, we take the difference between the simulated curve in step 2 and the reported case count in step 1 to estimate the impact of contact tracing, which is the number of cases prevented by contact tracing. So this model is a little different from the previously presented simulation model. You can think of it as a simpler approximation of the transmission dynamics. We also built an Excel-based tool based on this model that is publicly available, so that any jurisdictions that are interested can replicate these analyses by themselves. So now moving on to the next slide, we first applied this method to estimate the impact of the manual or the traditional contact tracing. And here are our findings. First, we found that the contact tracing had a meaningful impact in reducing cases. In one of our studies involving 23 states in the US, we estimated that the traditional contact tracing reduced the COVID-19 burden by as much as 17 to 21% during the peak of the pandemic, which is the winter month of November through January. Second, timeliness was the key. That is, how quickly you were able to notify your cases and contacts had the greatest impact out of all other measures of the contact tracing performance. And one way to speed up the notification without any additional resources is by prioritizing cases and contacts that have fewer days of symptom onset. And here's where the CA Notify can really benefit, because you can really speed up the notification if you fully utilize this exposure notification system. Third, we found a great variability across jurisdictions. In one of the lowest performing jurisdictions, we found that the contact tracing prevented 4 out of every 100 remaining cases that were not prevented by other interventions. On the other extreme, contact tracing prevented as many as 97 cases out of 100 remaining cases. Next, please. Next. So now we extend the same model to assess the impact of the electronic exposure notification, or EN. Our expected outcome from this project is that for every X number of notifications sent, exposure notification prevented 1 additional case. However, we had some challenges with this process. First was the low adoption rate, or the number of daily active users. One study by MIT finds that if the adoption rate is lower than 10%, the effect of EN is limited. However, in some jurisdictions, we found that the adoption rate was as low as 3 to 5%, in which case it was really hard to tease out the impact of EN. Third, there's this unknown overlap. There's this unknown compliance with quarantine guidance. So once you're notified through the electronic notification, we don't really know how many of them fully complied with the quarantine guidelines. And last, there's this unknown overlap between contacts that are identified via electronic notification versus the traditional contact tracing. So when these parameters are known, as previously explained, we usually make assumptions or educated guesses, but unfortunately, we don't really have enough data from the field to validate our assumptions. Next. So to summarize, the impact of electronic notification was influenced by many factors, such as the willingness to use the app, as well as the willingness to adhere to quarantine guidelines. But estimation of this impact is a difficult job, as you can imagine. First, the number of downloads of the app is not a good impact measure. So both the cases and the eligible contacts have to be active users for the system to work. Second, it's difficult to fully measure all the cascading elements of the electronic notifications or the indirect impact, such as the behavioral changes. Third, we had this question of unknown compliance, also unknown overlap between the two groups of contacts. So in conclusion, we believe that the electronic exposure notification can help, but it is unlikely to replace the standard or traditional contact tracing. So this is the end of the presentation. If you have any questions or if you're interested in replicating this kind of analysis, you can reach out to us at HEMU, HEMU@cdc.gov. Thank you.